I'm Susan Simpson with the Oklahoman. I'm here with Pamela Cross. She's Executive Director of the Health Alliance for the Uninsured. Hi, Pam.
Hi, Susan. Thank you.
So tell us, what is the Health Alliance for the Uninsured?
The Health Alliance for the Uninsured is a new nonprofit that grew out of a community collaborative in 2006. Community leaders, faith-based organizations, agencies all came together to begin to address the crisis of the uninsured.
What are the statistics concerning uninsured Oklahomans?
In Oklahoma, we have between 600 and 700,000 Oklahomans without health insurance. In Oklahoma County, we have approximately 140,000 people without health insurance, and that number, unfortunately, is increasing.
Why are there so many uninsured Oklahomans?
We have a lot of Oklahomans that work jobs that just don't provide health insurance. Even employers that used to provide that for their employees, as the cost of providing health insurance raised or grew, they had to decrease that benefit. And we have Oklahomans who are working 2 and 3 jobs but not able to afford health insurance.
So the face of the uninsured is not what you might expect?
No, it's not the homeless. It's people that we meet every day in our lives. It's our neighbors, church members, anyone who's struggling financially these days.
So for those of us fortunate enough to have health insurance, why should we be concerned about those that don't?
Well, I think we would all want those who take care of our children, our sick and our elderly, to have good health care. We would want restaurant workers to have health care. Anyone who impacts our lives, we want to be healthy. Also, for those of us with health insurance, it increases our health insurance premiums and the price we pay for health care when there are those who can't afford health care. And they may end up going to the hospital or delaying treatment and then having more expensive care than if they had it readily available to them.
Sure.
So it truly impacts all of us.
Right. So for persons without health insurance, they can have more health problems and difficulties.
Oh, yes.
Because of that lack of access.
Yes. Many of us with health insurance take for granted that process of contacting a physician when we don't feel well, going in for medical care, getting our prescriptions filled.
Right.
But if you don't have health insurance, each of those is a decision that you have to make. Do I get health care, or do I pay my rent, purchase food for my family, just basic life necessities? So if we have health insurance, that really is fortunate for us, but we do need to be mindful of others.
Tell me a little bit about things the Alliance is involved in to help.
Well, early on, we saw our role as providing awareness of the issue. So we held many meetings with legislators, Chamber of Commerce, agencies, getting people really aware of the magnitude of the problem in Oklahoma and the impact that it was having. Then we talked with free health clinics. In Oklahoma County, there are currently 17 free health clinics. They are most often faith-based and part-time clinics that for many years have been trying to help those who didn't have access to health care. But right now, as the number of uninsured has increased, these clinics are overwhelmed. So the Health Alliance is looking at ways to support those clinics. And the first thing that we did was ask what your needs are. So we began to focus on the need for medications. We started a cooperative central pharmacy that's a partnership with Oklahoma County and Good Shepherd Ministries. It's open 2 days a week. It serves low-income people from the community as well as free clinic patients and providing medications to the free clinics to dispense. And then we purchased a patient clinic management software. You know, there's a real focus right now in healthcare about electronic medical records and improving patient safety. Well, we believe that the quality of care for the uninsured needs to be just as good as for those with health insurance. So by providing this, we're focusing on patient safety and accountability, helping clinics quantify what they do, and that helps them raise more money to provide services. And we can also identify what the unmet needs are.
Sure. Can we find out more about the clinics and the pharmacy on your website?
Yes, on our website, which is www.hauonline.org.
Oklahomahauonline.org.
Yes.
Okay. So tell me about the partnership you have this month with the Oklahoma Blood Institute.
Oh, we are so grateful that the Oklahoma Blood Institute doesn't just focus on the blood needs of our community. They are truly concerned about overall health. And of course, blood donors have a special concern about health, or they wouldn't go and contribute blood. So during the month of January, those who go to the Oklahoma Blood Institute donor sites will have the option of not taking the traditional incentive gift, but instead having OBI give a financial contribution to the Health Alliance, and we'll use those funds to purchase medications.
Okay. So instead of getting a T-shirt for giving blood, you can opt to say, I'd like that money to go towards this effort.
Yes.
Okay.
Yes, well, OBI is aware that you can only take so many T-shirts and store them, and sometimes donors would like to do something more.
And it's giving twice.
It is. It's a wonderful partnership.
Yeah. Well, thank you very much, and I appreciate your time today. This is newsok.tv.
Thank you, Susan.